I think a lot of people have the conception that chiropractors put bones back into place and that we just magically, put everything back together if we're crooked or if we're stiff. And the truth is first of all, if we could do that, that'd be like an insane magic power to
Yeah,
have. I think would be making a lot of money to showing off the magic touch that we have. But at the same time, what we do instead of the thought process of putting bones back into place is we actually try to put motion back into these areas that might have restriction or difficulty. So when we can do that, then we can feel like things are more connected and the body can actually move the way it's supposed to.
welcome back to our podcast. Today we have Dr. DeCruz with DeCruz Chiropractic Center. How are you doing today?
Hey, Mackenzie, I'm doing great. Thanks for having me on. Looking forward to the discussion today. So.
Yeah, this is great. And out of all the podcast guests that I've had, you were the first one like I don't actually know. So this is really exciting because I feel like working with Integrity for the last 7 years, there's a lot of people who I have met. And so when I got matched up with you, when we were talking about doing the podcast, I was like, oh, this is great. I don't know anything about him. I would love to hear more about, how he got to where how got to where you are today, and then kind of ways that we can work together and just patient education and stuff like that. And so to start off, I wanted to see, when did you realize that you wanted to become a chiropractor?
Yeah, so growing up, I was always a sports fan. So I was always fascinated with human performance, watching athletes perform at the highest level, and I wanted to get a better understanding of what made them great. How did they recover? How did they move? How do they take care of themselves? What practices did they perform to make sure that, not only were they performing at a high level, but they were able to be available, manage injuries, mitigate the risks of, all the sports and activities that they were doing. So being, interested in that, I basically after I graduated from my undergrad degree at FSU, I majored in exercise science. I spent some time working at a hospital. I was kind of looking at the acute care setting originally, and I just didn't really think it was as much for me because, it's obviously a lot of sick care and a lot of hospital,
Yeah.
just like hospital life with a lot of the patients that you're treating there. So actually, what was funny is my neighbor, back home in my hometown in Melbourne, happened to be a chiropractor. So, just kind of running into him one day and just having a conversation, he invited me to the office to kind of come check out his flow, his shadow. It's actually Dr. Brad Watt in Melbourne, Florida. If he ever runs into this, just giving him a little shout out. But
Yeah, that's awesome.
so basically, he invited me to just kind of look at the office flow and just see, kind of what he did, because I didn't really know much about chiropractic. And, kind of spending some time doing that over the course of a few sessions, I just realized it was something that I wanted to do for me, because I really love the way that, he connected with patients, how they really, looked forward to their visits, how they wanted to, be coming in for their appointments and getting the treatment that they were, and how it actually enhanced their quality of life. I thought it was something that I could, really take and run with. So.
Yeah, and I think too, with you being a chiropractor and just other chiropractors in general, you guys are seeing patients really often, right? So I'm just thinking
Yeah.
about the chiropractor that I saw for years, seeing her twice a week and seeing them for, a while. You get really close, and it's a completely different relationship than maybe obviously a primary care physician or anything else like that. And so I think it's something that's really special between the patient and the chiropractor, because you are working together. It's obviously in your best interest to, get them back to where they need to be. But there's something to be said about that. And where did you
Absolutely.
go to school?
Yeah, so I went to Palmer College of Chiropractic in Florida. So the campus down in Port Orange, which is right by Daytona. So I just kind of felt like I did a big lap around I-95 and I-10, and I just kept going back and forth. So went to FSU, came back down, then came back up to Jacksonville after I graduated. Melbourne's right down there too. So a lot of time in the Northeast and Central and West Florida. That was how that happened.
Why Jacksonville? What brought you, what was the deciding factor?
Well, I think naturally when we all, graduate from grad school or undergrad, we're all, kind of going through the job search life. So originally, if I'm going to be honest, that's kind of what happened. It's just kind of what brought me here back in 2019. And then after COVID happened, it just kind of felt like, I initially didn't know if it was going to be a long-term move. But, when COVID happened, I kind of settled down a little bit more because, there wasn't much movement going on then. So, and yeah, 7 years later, I guess we're still here. So. it worked
No,
out.
that's great. That's great. It's funny too. Have you noticed that there's a lot of people that are here from Jacksonville, or do you notice the opposite?
Well, it's funny is I don't think Jacksonville like it was definitely one of those areas that you obviously know has a lot of land and areas that that can fill out more population wise. And I do think that there has been this general great migration to Florida, over these past 5 to 6 years since 2020. And Jacksonville for sure is I am running into more people that were not from here originally, but have made their home here just kind of the way I did too. So. It kind of
Yeah.
worked out that way too.
Yeah, it was definitely in 2020. There were so many people that moved here. But that, and it's funny too, because with meeting people here, even just with patients who have moved kind of around that time, like around that migration area, when you tell them, because I was born and raised here, when you tell that, you're like, wow, like you don't really hear that often. And so that's cool. But it's nice, for other people who've lived other places to make Jacksonville their home and obviously bring something good to the community, which is
For sure.
DeCruz Chiropractic Center. So
Absolutely.
walk me through that. How long from the time that was it right whenever you moved here, you decided to start your own, uh, practice, or what was the situation like?
Yeah, actually, I definitely it was not something I'd started originally, and I'd actually going through school. I knew initially I was going to be an associate coming out of school because I wanted to gain more experience and kind of learn a little bit more of the lay of the land from people who had done it. So, I kind of obviously going through that route, working in a couple of different settings. You get familiar with best practices and kind of how to manage an office and a practice, and in terms of not only helping it grow, but also making sure that it's has a really strong foundation in what it does and takes in taking care of patients in our profession specifically. So I spent time being an associate actually for 5 years, and then in 2024.
Mm,
The way the timing worked out, I just figured it was the right time to go ahead and take a leap, and that's kind of how we started. So November 24 was when we opened DeCruz Chiro Center. So it's going on 2 years, we're almost there. But yeah, it's been a fun couple of years learning a lot of stuff. So
that's awesome to hear. And where are you located?
we're in Jacksonville Beach, so right off Beach Boulevard. We operate in salon lofts. We have a space where we basically have all of our treatment, examination. It's all performed within that office space, so patients can come in, just get everything done there when it comes to their chiropractic visits and appointments. So.
Yeah. And how have people found you, initially? And I've seen on your social media that you've done some things in the community. It was like cool culture, which by the way, I've been wanting to do that, but I feel like every time they have an event, my husband and I, our family, we always have something going on because the Pilates place that I actually work at, they do, I think they
Yeah.
do cool culture, a ton. And so I've seen that you do that. So how have you gotten a lot of new patients from, doing things in the community, or how has that been coming in?
Yeah, absolutely. So we do community events like Cool Culture. There's other pop-ups where we've kind of actually met different vendors at specific places, and we've done our own pop-ups with those specific places. Maybe just going to one of their Saturday classes and just having a table and a stand where we could do demo treatments for people. But a lot of it's also word of mouth referral. The cool part about Jack's Beach is it's a very health-based community. So a
Yes.
lot of people, once they start coming in and they get familiar with you and they build that trust, and they feel pretty comfortable, referring other people that, are their friends and loved ones to go see you as well. So, the cool part about having a community like that is it does grow within itself. But at the same time, also, we make sure we have a strong online presence where, I know that social media can be kind of like a challenging and intimidating thing for people. But for me, it's kind of been one of those fun things to kind of try and explore a little bit more of, recording videos, whether it's obviously, treatment content, educational content. Every once in a while, you have the funny stuff you like to kind of work into just to connect with people to let them know you're a human as well. So we kind of, kind of mix it up with that a little bit. And then, of course, anytime we can get into community events where we could just meet more people, because, you never know who you're going to meet when you do go to these things. And that's just kind of the approach I take with it. And, it's kind of cool where, you might meet someone at, a networking mixer, and then you have that interaction, and then maybe 6 months down the road all of a sudden that person's giving you a call or reaching out because there's something that might be helpful to them, that your office offers and what kind of services we can provide. So yeah, it's just kind of cool when the more you stay engaged with these kinds of things. I've learned that it can be super helpful. So
With you also being in Jack's Beach, we always make this joke over here because, we're we're in the Mandarin side of town, but when we do have patients that are from Jack's Beach, thankfully, since we're specialists, like, it's not like they have to come here all the time. But the joke is always like, okay, well, if I don't have to cross over the bridge, like, I'm not going to.
Mhm.
So Jack's Beach
Yeah.
really is like a little community, because it's like, listen, if everything is here that I need, I am not leaving, and we're staying on this side. So that is awesome that you have that, and that everyone in Jack's Beach has can have you as a chiropractor. But also going back with social media, well, that was another reason why we started doing the podcast, was just, like I was saying before, I've been with Integrity for almost 7 years. And I initially started off as, doing sales and marketing, and meeting a lot of people in town, personal injury attorneys, chiropractors, pain management physicians, and just building those relationships. And so as we built those up, I was like, okay, now, like, what can we do? Because I feel like we've sustained a lot of them, and we've grown really close with a lot of people. And we approached this company, and we're like, okay, what do you think we can do? So we talked about the whole podcast thing, and it's been great, really and truly, because now my role is EVP of the company. So I'm running the day to day of the clinic, making sure that the physicians need everything that they have. And so I'm not doing a lot of the face to face marketing. And so doing this, I'm like, yes, this has been like my bread and butter. This is how I started with all of this. And so one thing that's great about social media that will, with nowadays, is it makes it so easy for potential patients or patients of yours to really connect. Because even for me now, like, I don't even think I Google a lot anymore. I go to like social media and I Google stuff.
Oh
It,
yeah,
it's just
absolutely.
it's the way of things are nowadays. And now with everyone using ChatGPT, one thing I've learned, and I don't know if you know this, is chat is pulling a lot of stuff from social media, but it's also pulling a lot of stuff from YouTube. And so a lot of these, all these podcasts are going up on YouTube because, with a lot of questions as far as like, hey, I've been in an auto accident. Let's just say I don't have, private health insurance. Where can I go? I mean, it's grabbing a lot of stuff to where like Integrity is popping up. Like we were saying before, the technology really is so mind blowing to me, but we're trying to get better at like the other social media stuff. I'm like, we can get the podcast locked down, but social, and I've seen it, you do a really good job.
Thank you.
It
Appreciate
just,
it.
like I said, it makes people connect more. It's easier to connect. They can feel like they
Absolutely.
know you.
Absolutely. Yeah, and
No, so
that's the
that's
thing
awesome.
too. Yeah, it's funny because even you said, oh, we don't really use Google anymore. Even Google's using AI. Anytime you type in something, the first response the AI mode turn on, it's already funneling you the information you actually want to look for. So the way it's kind of evolved and changed from what it was maybe even just a couple of years ago is pretty cool. So
Honestly, I feel like it happened overnight, to be completely honest, and it's like once chat came out, everyone's like, are you using
yeah.
chat? And then there's another system, it's not chat, there's another one that's out there that I think it's like really good for documents. I'm like, oh, okay, this stuff needs to slow down, but it's really interesting too, because I'm like, that's what we utilize every single
Yep.
day in our all day lives
Yeah,
too.
absolutely. Making sure all the T's are crossed, I's are dotted, and everything's down to a
Everything.
T. So yeah.
Yeah. So what are some modalities that you guys treat at DeCruz Chiropractic Center?
Yeah, so we actually, in addition to chiropractic manipulative therapy, aka the adjustments or the cracking, as
Yeah.
people want to refer it to, we obviously do different styles of adjustments. So we can do hands-on, we can do instrument assisted too, if people are more comfortable with that, because sometimes we know that they might be freaked out by some of the said cracking sounds. But we also like to integrate it with soft tissue therapy. So we're going to perform, therapies like instrument assisted soft tissue, mobilization, aka scraping. We can also perform cupping with patients too. Two great therapies, similar approach, different. We're trying to, work on myofascial pain and basically the layer that surrounds muscle tissue. So when people are having inflammation and symptoms related to muscle strains and irritation, those are two really helpful therapies that can, help address some of that, with, their symptoms. And then also, what we've recently started doing more of is shockwave therapy. So I'm sure you might be
I
familiar
saw
with that
that.
at Integrity, but
Hmm.
yeah, definitely something that we know has been a game changer for us. We are able to treat so many types of musculoskeletal issues, whether it's an acute injury or a chronic issue, especially with shockwave therapy. So similar to what people might have had if they've ever had ultrasound treatment or electrical stimulation, where with shockwave, we're actually using acoustic sound waves that help penetrate into the muscle muscle tissue, and it helps, improve the circulation of that area, and it also helps increase stem cell and collagen production in those areas too. So anytime we can stimulate blood flow and stem cell production and collagen production, we're obviously going to help the healing process. Inflammation is a part of healing. We understand that people are going to have symptoms related to that, but we want to make sure that we can help actually alleviate some of the actual pain that comes with it too, so that they can start to recover better and heal faster. So integrating both approaches has been really helpful because we can perform only chiropractic over and over, but if we're only going to do that, then it might have a longer duration of that person's recovery, and we could have mixed results. But if we can actually integrate and kind of address it from different aspects, that's what we've been able to do with some of the modalities that we've added into our treatment. So
You guys having shockwave therapy, it goes to show to the modern approach that you're taking with shockwave.
yeah,
Because I mean, our interventional pain physician who's here with us, he does shockwave therapy, and I had never heard of that before. And there's not a lot of people, I think, who have that, but the technology that you said that's behind it, I mean, we are having a lot of successes from patients who are doing the shockwave therapy. And this could even be, after surgery or even previous to surgery. But I mean, we're definitely
absolutely.
seeing great results that come from that. So that's really cool to hear that, that's something that you guys offer there at your office. And now speaking with, everything that you can treat from your end, you do work, with personal injury patients,
Yeah,
right?
correct. Yes, we do.
So from okay. And so from your side of things, when do you feel like it's absolutely necessary to send over to a specialist? So here at Integrity, we have Dr. Rizik, who's our orthopedic. Oh, give me 1 second. This happens in my
That's
office
okay.
all the time. I'm like, I promise I'm here.
Yeah, we got to
Um,
clap it on, right? The clap on lights.
no, but absolutely. But Dr. Ralph Rizik is our extremity orthopedic surgeon. So he handles all of our extremities. We have our Dr. Glickman, who's our neurosurgeon, who, does all of our spine cases. And then, like I said, we have Dr. Eli Locke, who's our interventional pain doc. So when do you feel like it's absolutely necessary from your end, like from a chiropractor standpoint or chiropractic standpoint, to then send over to a specialist? Like, is there something that you're looking for? Is there something that you've noticed on an MRI? Is it, maybe the adjustments and or other therapies that you've done maybe aren't working? Like what, walk me through that.
Yeah, absolutely. You kind of hit on a couple of aspects of what we look at already. Sorry, I think someone just rang the doorbell. The dogs might be
No, it's
barking,
okay.
but
Can't hear it. You're good.
basically, what we're looking at is we try to for each patient, it might be different with how they're actually responding to conservative treatment. So initially, we like to see if that's something that's appropriate and reasonable for their care. So if they're doing really well with that, then we still want to have in the back of our mind that it's important to get a second opinion and to get that evaluation from another physician like an orthopedic doctor or a pain interventional pain specialist. Because anything in healthcare, I kind of look at it as like a professional sports organization. There's different levels to how we try to get the best outcomes, and everyone has a different role in what they play. So, as a chiropractic physician, my perspective might be looking at it in terms of more of a musculoskeletal evaluation of, how do we look at joint pain and muscle strain and the relationship between the two, and if patients are having imbalances or movement restrictions. Interventional pain specialists are going to look at these pain triggers that are limiting people from just living, and getting through the day without having symptoms kind of, just limit their life, capacity and their ability to perform daily activities. And then orthopedic specialists are going to look at the structural integrity of what's going on with the patient and if surgical intervention might be an approach that they need to take. And then, if we're going to also, integrate with physical therapy, they're probably going to look at things like, how that person's operating with a functional capacity, just within, their regular activities and their movements. So all of these different things are important to actually helping a patient get the best outcome. It just might be different with the timing of when you might refer to based on what a patient needs. And actually, a good example of this happened not too long ago. So we did have a patient who came in after having an auto accident injury. And, so usually you're going to be able to perform an evaluation and maybe start with some initial conservative treatment with that patient. When it came to her exam, she was so hypersensitive to every possible trigger, where there was, the lighting was too much for her, where she had light sensitivity, she had sensitivity to touch. And there was so many triggers and so much inflammation and pain in that moment for that patient that we probably weren't going to be able to perform any effective chiropractic treatment. So, our evaluation told us we probably need to refer this patient to someone earlier on, as opposed to, seeing if we can delay this, and or not delay, but if we can, see if they, would have a period of time where they could respond to conservative treatment. So, in a case like that, you might, need to refer to one of the specialists earlier on. But in essence, what I would think is that, Aaron, how I operate and approach it is, I always know that we do need to have everyone on board in terms of, being able to assess and evaluate these patients, but making sure that obviously, we all kind of, are able to operate within our own, scopes of practice with that. So
Yeah, and I like the way that made that analogy as far as like sports and, because the way that I see it is just like this little community, and you've got this circle, you've got this little pot, and you have like the patient in the middle, and you have all of these different specialists and physicians who are working on making that one patient better. You know what I mean? And so I feel like that's why we think communication here is so important.
yeah,
And the doctors that we have here are great as far as communication goes. And they really want to try to build a relationship with a lot of the other physicians, referring physicians or other physicians that are, in the community, because it's like we all have to be on the same wavelength, you know what I mean, in
yeah,
order to try to make
absolutely.
sure we're all on the same page of this. Now, there are times where, you were explaining that, the patient had a lot of inflammation and, um, maybe to be sent along to, a specialist or what have you. But there are times too where we see patients and, maybe we do start off with conservative treatment and they're still seeing a chiropractor. But I think this actually happened maybe a week ago or so. The patient was actually going back to the chiropractor the next day. And so our nurse was just like, listen, I'm all here for chiropractic care. They're fine to do whatever they want but as far as like the neck goes, I think they had a fractured vertebrae in their
Limitations for
cervical
sure.
spine.
Yep.
Yeah. And then just to make sure, and it's little things like that where I feel like there's been other doctors in the past have been like, hey, nope, no chiropractor, like very closed off to that.
Hmm.
Instead of knowing like, hey, the chiropractors, these patients can see multiple times a week. They can at least help out with, different modalities to try to get them back to where they are. And so again, I think that's why it's so important that when there's so many different hands in the pot that, communication is key. And no, so that's great. And I feel like
Yeah.
too, it's nice to know when there's other chiropractors who also know like, hey, this is what I can do, but there's only so much, and then it can, be kind of kicked on to someone else. But maybe still the patient can still be, training with you and somewhat, but just making
Yeah,
sure that everyone's
absolutely.
like, in alignment, no
Yeah,
pun
yeah, big
intended
thing.
there.
Like you said, it's like, if you have everyone on board and everyone looking at it through their own scope, you're less likely to miss stuff too. And then you can always determine what treatment and approaches are most reasonable and appropriate in those cases too, as opposed to you just kind of operating it through your own lens and maybe missing things and not, giving that patient access to things that might be more helpful or more reasonable in that situation too. So.
I agree. Now, have you had someone come and see you? Have you had a patient come and see you that maybe they were just coming to be checked out? They thought they were fine, but things ended up actually being more serious than what they were?
Yeah, I think we see that a lot actually. So we what I was going to touch on a little bit with that is, you will actually perform your evaluation. You'll perform your orthopedic testing, your general range of motion tests, your neurological tests, and those might indicate some things clinically of, okay, there could be pain triggers coming from a certain position. It could affect a certain nerve pattern as well. Sometimes all of that stuff is clear and you don't see anything on the surface. And then later on, after you might perform some conservative treatment and you order imaging studies, then you'll also actually, all of a sudden you'll find that, this patient might have structural abnormalities and, there could be compression, there could be, degeneration, disc pathologies, nerve pressure that some people might present asymptomatic with this stuff sometimes. So I always like to tell people you're not necessarily what your MRI is. But at the
Mm-hmm.
same time, if we ever do have issues where, we're having pain triggers and things that come up later on, we can kind of trace them back to where they could be coming from as far as, these injuries can be sourced from a certain point. And we're looking at your imaging study here that, structure is not going to lie in this situation. It's going to tell you what's actually going on under the surface. So, always good to have the clinical exam and expertise when you see a patient. but the imaging is also going to give you, obviously a confirmation or a lot more information as far as the stuff that you can't actually see physically. So
And there's times too where a patient will get into an accident and maybe they're fine for the first few days,
yeah,
maybe it might have, some soreness and stuff like that. But I feel like the radiculopathy and things like that can and also come a lot later on.
for sure.
And we, also see that too, where they'll come in for a new patient appointment and, their pain levels really aren't that low. And, we start out with conservative treatment and then we get the call later on that they're like, okay, yeah, no, like it's happening. And there's definitely findings on their MRI. And I know every
Yep.
patient is different in that sense of what comes from that, but it's like you said, it's definitely more common than not.
Yeah,
Than
absolutely.
not.
Because a lot of the time you can, like I said, everyone might have a different pain tolerance. Some people might be super sensitive and immediately feel all the pain and symptoms. Some people, these things can, not necessarily be present right away, but later on they can probably resurface just based on lifestyle activities and all the stressors that act on the body as, you just do normal things. So,
Yeah. It's funny too. In chiropractic, I didn't see a chiropractor until I think the first time I saw one, I was maybe 27, I think. And after going, I was like, man, what was I doing my whole life? Like,
yeah,
this is insane. Um, and then the more I went, I think, just speaking with other friends about chiropractic care, I feel like there's so many myths that are out there with chiropractic care.
yeah.
And I want to talk about that a little bit because, and my personal favorite, whenever I get adjusted, is my neck. I'm like, please, that is my favorite thing. But there are a lot of people
It's
who
either
get
your
so worried
favorite, it's
about
your
that.
favorite or your least favorite. That's what I've learned
Yeah.
over time. So,
Yes. Yes. I'm always like, all right, say the best last. This is the best. I always feel like a different person once I'm done being adjusted. But
nice.
for that too, I feel like there's so many myths that do come from, chiropractic treatment. So if you have someone who's watching right now and maybe they're on the fence as far as, being adjusted, like what is something that you would say to them? Because I do think one a huge myth that's out there is, okay, well, if I start chiropractic treatment, like I'm just gonna always have to go. So what do you say about that?
Yeah, that's a good one. I'll piggyback back off of that. And that's the whole thing. We kind of trace back to when we talked earlier about treatment plans. Like everyone's going to be a little bit different. You don't have to become dependent on, a certain approach like getting adjusted all the time. And if we kind of talk about, the integrated approach that we take too, if you're only going to the chiropractor, it's not going to solve every bit of, the problems that you might be related or dealing with when it comes to pain, inflammation, stiffness, occupational stress. We definitely have to, look at it in terms of how do we integrate this with the general approach of, making sure that we're exercising well, our diet is not creating more inflammation, we're sleeping properly so that
Hmm.
we have proper balance with, all of our hormones and, basically our body's in a good place where it's regulating inflammation better than just kind of being reactive to, oh, I need to get adjusted because I'm having some pain. So, if we're doing those things, usually the outcomes are pretty well. Some people might still benefit from coming weekly. Their jobs and their activities just might dictate that, there's so much stress that they're always going through that, it helps them to actually have a little bit of regularity with their care. Some people might, have a different state of how their body responds to stress, and they might actually benefit from getting adjusted less often, because they might do better with just getting more, making sure that they're exercising and staying in a good routine with movement. And then also, they're doing other things that, help them kind of stay in a good place. So, I always say, especially if I'm seeing someone for the first time, I always say we can start out at a certain place. It doesn't necessarily mean that that's where we're going to be the entire time. These things are fluid and they change a lot. Another myth that I was going to touch on too, I think a lot of people have the conception that chiropractors put bones back into place and that we just magically, put everything back together if we're crooked or if we're stiff. And the truth is what, first of all, if we could do that, that'd be like an insane magic power to
Yeah,
have.
insane.
I think I'd, would be making a lot of money to showing off the magic touch that we have. But at the same time, what we do instead of, the thought process of putting bones back into place is we actually try to, put motion back into these areas that might have restriction or difficulty, finding balance. So when we can do that, then we can feel like things are more connected and the body can actually move the way it's supposed to. Instead of just the adjustment approach, like I said, we try to integrate it with soft tissue therapy because, if we're having movement deficiencies, how do we address it from a muscle, joint, and nerve and making sure that all three of those things are connected in those areas so that we can properly not only heal, but make sure that we can restore functional capacity to these, these areas too. So, yeah, definitely something I always like to, emphasize to people because sometimes they'll come in and be like, oh, I have, this, I feel like this joint's stuck and or out of place and I need it to be put back in. And, just to make it clear, it's like if, we're putting the motion back in, we're not going to just put everything back in like, with a magic power or something like that. But
Yeah. And I feel
so.
like too, the first time you go, at least this was for me. So it's different for everybody, but I felt like the first time I felt amazing, but it was like the more I was going, I felt like everything was, kind of going back to, where things needed to be, in
Yeah.
a sense. But going based off of that as well, sticking with myths and stuff, and speaking about neck crackings and stuff, there's always this myth about like neck cracking can cause arthritis.
Mhm.
Now, what do you think about that?
Well, I think there's, it's interesting because I think there's a lot of these like witch tales we grew up with. I think are like
Yeah.
our elders
Yeah.
would tell us not to crack our knuckles and not to like self crack or self adjust, and that's actually something I don't recommend people do. Not because I think it's gonna kill you and I think you're gonna die on the spot if you adjust yourself. But I think over time you might create some additional strain that probably doesn't need to happen. The thing is about arthritic change is it happens over time when compression and lack of movement go unaddressed. When you're actually putting movement back into areas, and actually, releasing pressure from joints, usually, if anything, it's more beneficial to do that. Now, everyone might be different as far as, and I think we get back to the argument of over adjusting and over treating people.
Yeah.
But making sure that, also a big part of it is how do we re-educate, the movement to happen on its own too, and not just depend on the adjustment. Because I think arthritic change actually happens if you're not building strength and stability. There's the clap on lights again.
So awful. So
It's
awful.
okay. That used to be the trend back then. We were clapping on every type of lights. But yeah, the thing is too, I think it's also like, we can absolutely, see arthritic change happen if we don't address all these other deficiencies like the strength of the muscles surrounding it and the stability. So I think if any adjustments are helpful, I don't think they themselves cause the arthritic change. I think that there's other things that factor in, especially if we only depend on getting adjusted. So.
Yeah. And with you having like the education that you do, obviously the things that you treat every day, are there certain things that you feel like you might do differently than like the average person because you're a chiropractor?
Yeah, I think for me, I want to focus on approaches and actual techniques and treatment methods that would actually help the patient get better. And I think a lot of the time is, in the world of insurance billing, as we know, we can, do a bunch of services and bill a lot of stuff and, have them go around the merry-go-round of all these different types of therapies that might help them or might not help them. I think the big part of when you do an exam is you assess what the deficiencies are, and then from there you're able to focus on the treatment that's going to help them instead of in the fifth month of care still performing ice and hot packs that might
Yeah.
not have any effect or benefit to them at all. You're saying, all right, well, we're at this point, how do we just make sure that we're hitting the ground running with making sure that the movement's there where it needs to be, and if we're having anything that's starting to create some imbalance, that we don't go backwards to where we were, that we continue to make progress and we start to do things that are more progressive for you, when it comes to, obviously, with our chiropractic treatment, but with the co-management when we refer to other providers as well. So
Yeah. Without a
I'd say that's a
doubt.
big part of it. So.
I would think so too. But are you like, are you like, what's the right word to say? Like more conscious on like, posture and like just thing that, like I said, like as you as a chiropractor, like, are there things that you notice and you think about a little bit more than like the average person? Does that make sense? Like as far
Yeah.
as like, posture or just like shoes, or like, supportive, like little things like that. Like, are there
Yeah,
things that you do
absolutely. And
differently?
that's interesting. It's funny that you say that because I think you also shape some of these things over time because the way you move and the way you take care of yourself when you go to chiropractic school and when you're not in the profession every day compared to what you are, when you've been doing it for 7+ years is going to be a little bit different. I might be, and these things work well for me. They might not work well for everyone, but my thought process about posture is, well, there's no perfect posture, but if you get stuck sitting in a position for, hours and hours a day and you're not moving around enough, then usually you might have some more additional strain associated with it. If it comes to, wearing certain shoes, well, I might not wear, super elevated, um,
Shoot.
cushiony type of shoes. I might try to do stuff that engages my foot muscles a little bit more because I find that those are beneficial to me. So, if anything, I would say, you can assess every single person and try to tell them what's best for them. I think a lot of things people have to try, and you can only educate them on your
Yeah.
thought process behind it. So, that's, things that you learn over time, and you try to, just spread the wealth of knowledge when you do have it. So,
Oh, I love all of this. Now, and to kind of wrap things up, at least things on my end, where do you see yourself in the next 5 years?
yeah, absolutely. I mean, we want to continue the growth of the DeCruz Chiropractic Center with the patients that we're able to reach and treat. Obviously, being in a beach location, you do get kind of fixated on that community, but kind of what's cool about doing more cases with patients who have auto injuries or slip and falls is not all of those cases happen at the beach. We do have patients that
Yeah.
have these things happen all across Jacksonville. Jacksonville is such a broad area. We would definitely want to expand our reach into being able to help more people when it comes to the right time for facility upgrades, equipment upgrades, to make sure that we can provide an all-inclusive patient experience for everyone. To where it's not just the simple thought of going to the chiropractor and getting the crack. We're always trying to evolve it into more of a just an overall health-based approach for all of the patients that we treat. Whether you've had an accident or whether you're just coming to see us because you're looking for performance advantages to try to improve your quality of life. That's what we want to continue to focus on as a foundation and grow it from there. So
Uh, and based off of the social media that I've seen too, your office looks really nice. So props to you
thank
for
you. I
that
appreciate
as
that. Yeah,
well.
my fiance really helped me with the wallpapering part of it. And we
Yes.
kind of, it's got to have the women's touch for sure. Yeah, I definitely, could always, use her feedback on that, and she would attest to
Yeah.
that. So, but
Well, I think too with being on social media, nowadays, even though I know it sounds so silly to say, but it's so much easier. I feel like to be able to put content out too, and your
yeah,
space also looks nice too. On top of that,
yeah. If the door's shut in
so no,
session,
that's great.
I'm not always with the patient. Sometimes I'm just making some videos. that's the session that might be going on if I have that on there. So
No, we
just to
love it. I know
clarify.
our office has to get a lot better about that because even when we have done, social media and stuff like that, I mean, they've been really good, but it's almost like I have to give my team like, all right, heads up. Thursday this week at 3 o'clock, we are shutting things down and it's time to like create videos. It's like I have to
Yep.
like make sure of that to get
Yeah,
things
making
done
the
too.
time for it's the big one because all of a sudden you'll be
Yeah,
doing something, and then someone walks in, it gets a little tougher. So yeah,
it
we
does.
try
Plus
to
the
reserve
editing
our
side
time.
of things,
Yeah.
I get that. And editing
Hey, if you
takes a
can
lot
figure
longer,
out
which
podcasts, I think you can figure out any of that stuff. I think it
dude,
should be that
I'm
it shouldn't be
telling
too
you,
bad.
I'm telling you right now, I'm like, I feel like this one, I think this is maybe my fifth. I think this is my fifth podcast, the one with you. And I'm like, okay, I think we've got it down. I'm pretty sure I think we're
Yeah.
good to go. So we'll see
Fifth
what
time's the
happens here.
charm.
But
Fifth time's the charm. That's we got to get
yeah.
to number five.
Hey,
That was the key.
listen, five is my favorite number. So there you go. That
I was
works
gonna
for me.
say it was written. It was written already.
That's awesome. Well, are there any questions that you might have, for myself or for Integrity Spine Orthopedics?
No, absolutely. I mean, it's been a great discussion overall, and as you kind of learn more about pain management and orthopedic, specialists and how they work with chiropractors, I think that you guys, keep continuing to do the awesome things that you're doing because, it matters and it makes a big difference when it comes to not only case management but patient actually getting better and returning to not only a pre-injury status but hopefully elevating beyond that too. I think that's always the approach, and then it's the why we do what we do. So,
Yeah.
just big
And
ups to
just
you
like
guys.
sports, thank you. And I was going to say, and just like sports, it's all about teamwork here too. So
Absolutely.
I, yeah, and I really look forward to, hopefully, being able to treat some of your patients and maybe vice versa if we have patients that are out there and, need to start chiropractic care as well as, maybe some other modalities of treatment that we're doing here. So we'll definitely be in touch.
Yeah, absolutely. Looking forward to it. We'll see you guys at different events, I'm sure too. It's always,
Oh,
nice
of
to,
course.
you don't get to have a whole podcast when you talk to people at these events. So, we're already ahead of the
That
game
is a
with that.
fact.
So I
That is a
appreciate that
fact.
part of it. So yeah, we just have the business
Of
card,
course.
slippage here and there, but yeah. Then we have a whole
That's
collection of them
amazing.
after. So yeah.
Yeah, all of that I know, and you're like, "Wait, who is this person?" I get it, but and that's the thing too, I feel like there were so many, uh, more marketing events, I feel like, in the very beginning of this, and those
Yeah.
have kind of died down, which is another reason why I'm really liking, these podcasts too, just to have like a
Yeah.
one-on-one time and a good amount of time too. Because it's time before when I was, in sales and marketing, there were times I had lunches with people, but if it was just like, pop-ins and stuff, I only had like a certain amount of time. And, that's kind of hard to build those relationships. So, after time, it was like, after knocking on doors for
Absolutely.
a while, you kind of get there. So this is really nice to be able to, get it done this way.
Yeah, yeah, and yeah, I mean, keep doing. I'm looking forward to the future episodes and just continue to see where you guys go with it. It's gonna be great. So
Yeah, you got it. All right. Well, we'll talk
yeah,
soon. Okay.